Good evening, ladies and gentlemen, and welcome to yet another interesting topic. I remain my humble self, Lucky, Dr. Drugs, and tonight we will be talking about diabetes. We want to know if it is treatable, and if yes, how is it treatable? Yes, and without much ado, we're going to shift straight into the order for today. That is the table of contents, recording of soon. Now, a table of contents goes thus. We kept talking about type 2 diabetes, we're talking about lifestyle diseases because it is a lifestyle disease. Blood sugar and insulin, briefly, talk about the definition of type 2 diabetes, or talk about the definition of diabetes, its types, signs, risk factors, then the complications. Now, we're going to delve a bit deeper, talk about diabetes and obesity, or their relationship, diabetes and hypertension, so on and so forth. Then we'll talk about the challenges all the way down to chemical intervention, side effects, and of course, the importance of natural diagnostic. But let's not leave out a very important portion today, which is diabetes treatable? If yes, how? I remember my humble self, Dr. Drugs. And of course, I always mention the two greatest assassins being cholesterol and stress. And their presence in our bodies is strongly linked to our lifestyle choices. And cholesterol deposits directly or indirectly account for most cardiovascular issues and leads to ischemia, which simply means cell death due to poor blood flow. The stress leads to production of reactive oxidative species of free radicals that attack DNA. Remember, DNA is in charge of virtually everything. Us, lifestyle diseases are linked to one's lifestyle. They are non-communicable diseases, and examples of such lifestyle that can lead to lifestyle diseases include lack of physical activity, poor dieting, alcoholism, smoking, and so on and so forth. Now, these lifestyle diseases include type 2 diabetes, obesity, high blood cholesterol, fatty liver disease, and so on. But many of these can combine to form what is called metabolic syndrome. And of course, it is always better to tackle them earlier, because the earlier, the better, because most of them are actually treatable, if not all of them. And prevention is better than cure. Of course, they move together as is all for one and one for all. Now, blood sugar level is the amount of glucose found inside the blood at a particular point in time, especially at the time of testing. And a sustained elevation of this blood sugar above normal range is what is known as diabetes mellitus, or simply diabetes. We keep hearing about insulin, but I also don't understand that insulin is more like the gate man that allows sugar, or gives the passport that allows sugar to be able to what? Immigrate or emigrate out of the blood into the tissue or cells of the body. That means anything that hinders insulin function or the availability of insulin affects the flow of glucose from the blood into the body cells, leading to an excess amount of glucose in the blood. And of course, high blood glucose that stays high for long is called diabetes. The simple definition is, by definition, diabetes is simply a sustained elevation of blood sugar level above normal. This elevation of blood sugar leads to a lot of other complications and damage in the body. Now, controlling this blood sugar level is key in the management of diabetes. Now, anybody can be diabetic at any time. That means it depends on one's lifestyle. We'll talk about that shortly. So let's just know that anybody can be diabetic. It's a lifestyle disease. And its types include type 1 or juvenile onset or insulin-dependent diabetes. That means it's as a result of lack of insulin and happens in about 5 to 10% of cases. Then we have type 2 or adult onset diabetes, which is non-insulin dependent high blood sugar as a result of low amount of insulin and or inability of the body to recognize insulin. And it accounts for about 90 to 95% of the population. Another way of saying this diplomatically is insulin insensitivity. Now, pregnancy or gestational diabetes happens during pregnancy and often reverses or resolves after childbirth. But let's not leave out some areas that we may not be aware can actually lead to diabetes. And for instance, pancreatitis, inflammation of the pancreas can actually lead to what? Diabetes. Now, factors that can cause this disease include alcoholism. Even type 2 diabetes itself can actually lead to inflammation of the pancreas. Certain drugs can cause it, trauma, gallstones, because there's a very strong link between the ducts that lead the gallbladder, and they find their way through back to the beginning of the intestine, the small intestine, the duodenum. And of course, the pancreatic duct meets with this duct before it goes into the small intestine, the beginning of the small intestine. That means anything that obstructs the flow of bile can actually lead to a blockage of that system, and that could lead to what? A backflow of pancreatic juice and lead to pancreatitis. So you can see that these things are all connected one way or the other, you know. So this is just an acronym, Get Smash, an acronym for us to remember the kind of things that actually can lead to pancreatitis, as you see over there. Of course, procedures like endoscopic retrograde cholangiopancreatography can actually lead to that as well. Fatty pancreas is something that actually happens to certain people. Just as people can accumulate fat in different parts of the body, it's possible to accumulate fat in the pancreas that we know produces insulin that helps us to regulate sugar. Of course, this affects blood sugar by disrupting insulin production, reducing insulin sensitivity, inflammation, beta cell dysfunction. Beta cells, or islets of Langerhans, are the cells that produce insulin in the pancreas. And of course, impaired glucagon regulation. And it's important to know that fat in the pancreas is often associated with what? Obesity, metabolic syndrome, and type 2 diabetes. So maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity can help reduce pancreatic fat and improve blood sugar control. Please, let's take let's take note of weight management, as we just said now. So what are the signs and symptoms of diabetes? The basic signs include excess urination. Now, the basic signs or symptoms as a result of excess sugar in the blood, which leads to the body trying to reduce this excess by voiding it through urine. Okay? And that leads to what? Excess urination, because the water that the body is trying to use to flush out the urine be making the patient to urinate often. That's called polyuria. And as a result of the high amount of water lost through the urine, the body demands for more, leading to what? Excess thirst. That's also known as polydipsia. And since the body glucose is not entering the cells, because diabetes is more like starvation in plenty, the glucose is there in the blood, but there's no insulin to actually, or the insulin has lost its function to actually allow this glucose to go into the cells to produce energy, or probably there is no insulin at all in the first place. And that could lead to what? Excess hunger, because the cells will be crying that they are not receiving any food, and then they begin to throw tantrums and make us want to eat more. And when we eat more, it leads to an excess glucose in the blood, and the process continues on and on until it finally finishes the patient if nothing is done about it. So like I said, these are the signs and symptoms: frequent urination, increased thirst, increased hunger, confusion and forgetfulness, headaches, itchy skin, weight loss, that's that was cachexia, blurry vision. This is very, very, very common. Talk about that shortly. Weakness. Remember that glucose is not even entering the cells in the first place. Depression. We'll talk about why that happens. Of course, paresthesia, that's tingling, burning, painful sensation at the hands and feet, and poor wound healing. Let's take note of this poor wound healing, because we know that bacteria love sugar. So when you carry diabetes and offer bacteria sugar through the blood, you see that they begin to grow very well there, happily, if there's an injury. If you look at this cat here, you are looking at someone that will most likely have diabetes in the nearest future, because this cat, of course, is obviously high, is drinking alcohol, is obese, and is lazy. Does this cat look like something or someone or an animal that exercises? No. Obviously, you can see that this is just an epitome or an ambassador for diabetes. Now, generally, anything that leads to the shortage or absence or loss of function of insulin results in diabetes. So, what this means is that high blood sugar causes diabetes and diabetes causes high blood sugar. Please let us bear in mind that anyone can be diabetic anytime, and it depends on genetic predisposition, lifestyle, and so on and so forth. This is a terrible vicious cycle that one must avoid. And so, like I aforementioned, one can be genetically predisposed to having diabetes. But let's bear in mind that genetic predisposition is not genetic sentence, because your lifestyle and environmental factors can actually trigger or support that genetic predisposition or suppress that genetic predisposition. I know someone that everybody in her family is diabetic except her. And if you look at this woman, you see that she's really taking good care of herself. So we talked about type 1 diabetes. What are a few things that can lead to it? Trauma or damage to the pancreas, autoimmune attack. For an unknown reason, the body begins to attack the beta cells of the islets of Langerhans. And of course, surgical removal of the pancreas is not left out. Viruses are not left out. Genetic predisposition and pancreatitis and so on and so forth. In type 2 diabetes, there's often insulin produced by the beta cells of the pancreas. But insulin is not recognized by the cell receptors, leading to insulin resistance. When you hear insulin resistance, it's just a diplomatic way of saying type 2 diabetes. Now, it often happens at the early stage. We call it insulin resistance because we don't want to, just make someone so scared or something and put it that way. It's actually what, in fact, it's just another way of saying type 2 diabetes, in short, or a more subtle way of saying type 2 diabetes. Now, the risk factors include poor dieting, obesity. Can see that about 60% or more of patients with diabetes are overweight. Take note of that. Smoking, alcoholism, pregnancy, lack of exercise, aging, lack of vitamin D. Who knew that? Lack of vitamin D could actually provoke type 2 diabetes. Some people are always in the house watching movies, pressing phone, moving from AC to AC to AC. They don't even allow sun to even touch their skin. You can see that it can predispose one to type 2 diabetes. And stress is not left out. In fact, there was a period I noticed that there was a rise in stress-induced diabetes. It was amazing. You find people having diabetes and they are the only one in their extended family and nuclear family that have diabetes. And when you ask them, they'll tell you that they don't rest. These are hustlers. Today they're in China, tomorrow they're Australia, later tomorrow they're on their way to UK and all that. They don't rest. Before they're calling the person in the port. What about the container? Has it landed? Maybe sleep and rest for where the wife will be the enemy of progress because she's telling him to rest and all that because of money, also. Next thing, type 2 diabetes. And they're wondering whether it's from the village. It's not. It's stress. Now, what are the complications? Diabetes is a disease of diseases. That means it leads to the manifestation of other diseases and production of lots of free radicals. These are the things that damage DNA via glucose oxidation that cause more damage. Some cells in the body don't require insulin to allow glucose enter them. They are insulin-independent tissue. So glucose just goes in. That means once the blood level of glucose is high, it just moves freely in there. And that means there's a possibility of the glucose going to what's called the polyol pathway into sorbitol. And sorbitol will pull in more water until it damages those cells. A few of those cells include the retina of the eyes, the kidney cells, that's the nephrons, and then we have the nerve cells. If you look at these three I just mentioned, you find that blurry vision is not unusual, kidney damage is not unusual, and then nerve damage. That's why you see peppery sensation and all that associated with, type 2 diabetes. So more specifically, there's diabetic retinopathy, diabetic nephropathy, that's nerve damage, then diabetic neuropathy. There's diabetic neuropathy, that's nerve damage. And then we have diabetic nephropathy, that's what happens to the kidneys of diabetic patients when there's kidney damage. High blood cholesterol is not left out because diabetes directly increases bad cholesterol in the system. I'll tell us why this is very, very important and is linked with hypertension, and other issues. Then we have cardiovascular diseases, they are not left out. Cerebrovascular diseases like ischemic stroke and all that. Why is it that hypertension and diabetes often go together? Find out shortly. There's less swelling. That's why sometimes some people finish eating, they feel this a little dizziness. You seem as if they are not high on alcohol, but it's just as if the vision is kind of not, there's a slight change in their vision because of less swelling and all that. Erectile dysfunction and infertility is not left out. Infertility is, in fact, one of the saddest things that diabetes causes because it damages DNA. And these cells that lead to that determine whether one is fertile or not, as the gamete cells, the egg or the sperm cells, are just basically courier of DNA. They just convey DNA to the meeting point where the mother brings half of the material, the father brings half, they combine to form the baby, short. But you can see that diabetes leads to production of free radicals that damage DNA directly. And that's why it can lead to a very, very poor semen analysis result. Let's see low sperm count, or we have azoospermia, no sperm at all, oligospermia, and all these big grammar. I don't want to speak here for now. And you see that the patient begins to run from pillar to post, or you hear it's grammar like non-viable eggs and all that. Diabetes can lead to all this. Talk about that some other time. But of course, erectile dysfunction, remember that high blood cholesterol associated with diabetes can actually block the pipe or the blood vessels that are leading to the penile shaft. That's those that are supplying or that are supposed to engorge the bulbous spongiosum and the others, and cavernosum and all that. And you can see the erection is either is not sustainable or it's actually not even attainable at all. That's what diabetes can do. There are a lot of patients that have diabetes that are not having erection at all. It's because of this issue. Let's not even talk about the nerve damage, because you know that the erection is also has a very strong link with nerve supply, especially those that are coming from the S2, S3, S4 in the sacral vertebrae. You can see that diabetes also leads to damage of nerve fibers, and you can see that that can also allow those that can also prevent the erection, or can also lead to erectile dysfunction. That's just on the side. We'll talk about that more later. Brain damage is not left out. Diabetic foot, dementia, forgetfulness. Of course, delivery issues. When mothers have diabetes, their babies are often gigantic because they have consumed a lot of sugar in the uterus, and to pass can be a serious problem, leading to a cesarean section and a lot of other complications. In fact, it can actually also lead to cerebral palsy, especially when the baby struggles so much and lacks oxygen along the way. You see them coming out, they're not crying, they are blue, and after some time they do give oxygen and all that. The baby starts to cry, and some years later the child is finding it difficult to catch up, or has delayed milestones, or is having signs of autism and all that. Yes, diabetes can actually lead to all these things. Apart from the fact that if a mother has diabetes, she predisposes the child to intellectual disabilities, you can see that delivery can also become difficult and also further increase the risk of intellectual disability. We'll talk about that some other time. Of course, DNA damage is not left out, leading to aging. Remember that aging is basically DNA damage. That's what leads to aging. But fibroblasts that actually produce the collagen fibers and begin to have malfunction in their production processes, leading to faulty collagen fibers that make the skin begin to wrinkle. Because collagen is what is responsible for the structural integrity of a lot of structures in the body, bones, cartilage, the skin, as well as other parts of the body. So you can see that diabetes can actually provoke the production of free radicals that attack the DNA and worsen these things and make aging very fast. Wrinkling of skin is not left out, infertility as aforementioned, arthritis is not left out. Then, of course, death, and the list goes on and on. Very terrible disease. Then we have the link between diabetes and obesity. Look at the bottom right part of my screen. You find some people just keep eating and wondering why they are having type 2 diabetes. The reason is this: obesity is excessive detrimental accumulation of body fat, and fat cells secrete adipokines or adipocytokines that directly provoke type 2 diabetes. That is just the truth. That's why about 60% or more of patients that have type 2 diabetes are obese. So we'll be talking more about type 2 diabetes because we know that type 1 diabetes has no cure except one takes insulin directly from outside sources. So the steps are like this. There will be insulin resistance. Remember, I mentioned insulin resistance as a diplomatic way of saying type 2 diabetes. Then there will be pancreatic strain, that is the stress as the body cells become less responsive to insulin. The pancreas has to produce more insulin to compensate. And this puts a strain on the pancreas, which can lead to pancreatic fatigue. Who knew that the pancreas can get tired, like an athlete that has run for too long? Then we have inflammation. Then we have impaired glucose regulation, and before you know it, the patient graduates into full-blown type 2 diabetes. So diabetes and hypertension is a very strong link. We don't know why people have hypertension and diabetes. If we don't know why people have diabetes and hypertension going side by side, oftentimes this is the reason. Diabetes and hypertension often go hand in hand because the atherosclerotic or cholesterol blockage caused by diabetes leads to an increase in peripheral resistance. This increase in resistance to blood flow leads to a compensatory increase in blood pressure by the heart to overcome such resistance to blood flow, leading to high blood pressure. In short, when the heart tries to compensate for this blockage by increasing the pressure so that the blood can squeeze through the blood vessels that have been blocked by the deposits of cholesterol, or let me say atherosclerotic plaque, then when this increase in pressure is sustained, that is just known as hypertension. So you can see why they move side by side. So diabetes, cardiovascular disease, and eye health issues. We just talked about that a bit, but let's remember that controlling blood sugar level is important or pertinent in management of diabetes. Diabetes leads to an increase in bad cholesterol level that leads to cholesterol blockage, as I just mentioned, that of blood vessels in the heart and other parts of the body, leading to cardiovascular diseases, including hypertension. So as peripheral resistance increases, the heart pumps with a compensatory increase in blood pressure to squeeze blood through the constricted blood vessels. When this increase is sustained, it is hypertension, period. Observe that diabetes is often associated with hypertension. So what about in the eyes? Because the retina of the eyes have no control of how blood sugar or how sugar flows from the blood into them, they can get damaged leading to loss of vision or poor vision. Because once they are surrounded by high sugar, they just keep drawing the sugar in, and that can actually lead to their damage. Let's not forget that cholesterol blockage to the blood vessels of the eyes can lead to their damage and cause poor vision because the eyes also need to that contain the blood and they need oxygen. And because diabetes leads to production of free radicals that damage DNA, the cells of the retina begin to what? Malfunction. In fact, poorly managed diabetes leads to vision loss. If you look at the eye here on the left, you see that it's very smooth and all that. But just look at what diabetes is doing to this person's eye on the right here. Just look at it. It's already causing damage. Before you know it, the person begins to see in a way that they do not like. Just as the government reads budget every year to tell the citizens how they're going to, spend the money in the country, this is how diabetes is reading budget to whomever is its victim. You can see that starting from the eyes to the heart, to the blood vessels, to the bladder, the skin, to the foot, to the nerves, to the entanglement facility or penis, to the heart in terms of hypertension, and so on and so forth. These are just what diabetes does to damage the body. Just see how diabetes came as a visitor here and began to migrate into a regular visitor of this person's foot, drills a hole there, does not want to leave. Now it has turned the person that is the landlord into the tenant, and finally this foot has to be chopped off. We've heard about some celebrities that had their foot chopped off, and at the end of the day, some of them did not even survive because diabetes is a terrible disease condition. If you look at the guy at the lower right of my screen, find that you see him again shortly, he's not joking. Diagnosis is very, very important. It is diagnosed by measurement of blood sugar level with the use of a glucometer, and it is measured as this: fasting blood sugar. Normal range is 80 to 100. Pre-diabetes is 100 to 125, and diabetes is 125 milligrams per dl and above. Please and please and please, to those that are being deceived by those that are selling Coca-Cola and Fanta, telling you that a blood sugar level of 125 is okay, or saying that the normal range is from 70 to 140, please and please and please, is 80 to 100. That is the standard. Anything above 100 is already pre-diabetes. It's just like someone that wants to marry a woman and has gone for introduction, or what they call, is it house knocking, or what is it called? Has not yet engaged or had the traditional wedding. Traditional wedding happens when the person is now diabetic from 125. Let me just give that analogy. So don't let anybody deceive you. I noticed some results, they come and say that the patient is normal, and the patient is having sugar of 124. And I'm telling the person it's just one more step to graduate into the University of Diabetes. So one has to be very, very careful. Now, there's what's called 2 hours postprandial. That's 2 hours after a high carbohydrate meal. That's the range over there. And we have random blood sugar, where the normal range is below 140 milligrams per dl. So you can see that about 6 million Nigerians have diabetes, and about 18 million are unaware. What this means is that 6 million of Nigerians have diabetes and they know, and 18 million do not know as at the time the statistic was taken. That means 18 million people are just walking there, anything can just happen anytime, and they don't even know that. That's why it's important one does these checks more often. I don't know for why diabetes likes the south part of Nigeria. Maybe they are sweet people, I don't know. Now, what are challenges in management of diabetes? Late detection is also a problem, because overconfidence. When nobody has diabetes in the person's generation, you will not believe that it's possible to have diabetes, probably as a result of stress. Self-medication, Sabi news, is on that problem. Some people begin to take herbs, roots, leaves, this, while they're still drinking, smoking, keeping late nights, eating, using fufu to rinse their mouth every morning. They use Coca-Cola to brush their teeth, and they're wondering what's happening. You see whether their village people as well. Denial. Some people say it is not my portion, and the sugar is telling you, blood sugar, the glucometer is saying that you are having blood sugar of 150 to 200 to 250, and you're still shouting it's not my portion, and you are using Coke to brush your teeth or rinse your mouth every day. That's not nice, and this is a challenge. Lack of competent health practitioners. I know a country, it's one of the highest exporters of health practitioners in the world today. I hope God helps that country. Hypoglycemia, that's not hypertension. Hypoglycemia is not left out, because we will take excessive amounts of anti-diabetics when they are desperate to go out of it. And let's not even forget that some people abuse certain drugs like semaglutide, or what you call Ozempic and all that, and some of them sleep and find it very difficult to wake. Some of them wake up in the hospital because they have almost reached the land beyond. Now, poor health information system is not left out. So people go to the farm and come back and say that somebody put juju on their farm, not knowing that that thing that is making their food to rot is actually diabetic food. They start saying that somebody wants to take their land, this and that, and it is not correct. Some will go to churches and the pastor will say it is that your ancestral problem is type 2 diabetes that may be causing a problem. Lack of adequate health diagnostic infrastructure, poor medication compliance. It can be very boring to drink this medication. Of course, knowing that they are toxic and they are not safe. At the end of the day, some patients just say something must kill a man, they throw it away, and some of them unfortunately get killed by that action. Poor dietary compliance, because we know that diabetes has a way of increasing appetite. Somebody can be doing shawarma or baking bread at Surulere, and somebody at Lekki phase 1 that has type 2 diabetes will be smelling it, because the brain is just saying eat, and all that, because of what is called polyphagia. We explained that earlier, and that could be a problem. So discipline is very, very, very important. Self-control. Then economic issues are not left out. If you know how much these diabetic medication are cost now, you understand what, in fact, they are very, 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 very expensive. Then depression, this makes patients reluctant to help themselves because some patients will be like, oh my God, I've been doing everything right now. What else? Who have I offended now? And they're asking them, they are regretting and all that. And at the end of the day, they begin to fall into depression. But let's not forget the worst, which is suicidal tendencies, especially those that that they have had their foot amputated. You find that they lose interest in life and they're just searching for one way or the other to kill themselves. So such people need a lot of emotional support. So, ladies and gentlemen, we have landed. Is diabetes treatable? If yes, how? At this point in time, let's go to our Universal University, Google, and let's see what Google has to say. So, I asked Google, I said, how can one reverse diabetes? You see, Google likes to be very diplomatic because if it tells you that diabetes can be treated, and if you do not find your diabetes treated, you can go and ask Google, or you can hold Google by the trouser and say, you told me that diabetes is treatable, forgetting that there are a lot of factors that govern this. But let's see. He said that while there is no guaranteed cure for diabetes, that means there may be cure, but don't call my name. Significant lifestyle changes, particularly focusing on diet and exercise, can help many people achieve remission, meaning their blood sugar levels return to normal without medication. I am not the one saying this. You can type this on the phones and you can read for yourself. So, it went further to say, here's a breakdown of how to reverse or manage type 2 diabetes through lifestyle changes. They're just being diplomatic. But if you apply wisdom and dissect this very well, you see that there is a lot to learn here. Now, for pre-diabetes, okay, they said, yes, pre-diabetes is treatable. Because I asked Google, is pre-diabetes treatable? And it says yes. And can often be reversed or at least delayed with lifestyle changes again, like healthy diet, regular exercise, and weight loss. Sometimes you tell patients to give you their weight and height, and they're like, what concern my weight and height and my sugar? Please, there's high blood sugar, find me solution. Because they do not know that this excessive weight obesity can directly provoke type 2 diabetes. So find out why I'm talking about this, I'm emphasizing on this shortly. But before we even move further, have you ever asked yourself, I keep asking some patients that are overweight and they're taking diabetes medication. Some just believe, especially in some countries, they just believe that as far as they're taking their medication, they can do whatever they like. Because you find a lot of some hair practitioners, I've heard top hair practitioners telling patients, eat whatever you like and drink your medicine. That is very, very wrong. Don't eat whatever you like and drink your medicine. It's just like slapping yourself and telling yourself sorry every day. Why don't you mind what you eat so that hopefully you may not need to even take that medication in the first place? So there's no wisdom in that at all. So be careful because wisdom is profitable to direct. So this also says here is a more detailed explanation and keep going on and on. So I'm going to ask us at this point in time, is diabetes reversible, or can it go into remission, or is it treatable, or whichever language you want to use or not? You can type yes or no. We are here to learn. If it's a yes, fine. If it's a no, fine. We'll find out more after this seminar. Dissect that shortly. Now, let's delve straight into management and reversal of diabetes. Note that normal blood sugar after 3 to 6 months without medication is an evidence of remission. I do not say after 3 to 6 days, because I find a lot of people drinking all sorts of concoctions. They just find anywhere, somebody says the bottle is 80,000. If you drink it, your diabetes has gone. Just drink it after 3 days, and then they say that the diabetes is gone. It is not possible. Only God has that power. While obesity is a significant risk factor for diabetes, it is not the only factor. Maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet can help prevent or manage diabetes. Additionally, early detection and treatment of diabetes can help prevent complications and improve outcomes. So the steps include dieting, exercise, weight management, stop smoking, avoid alcoholism, discipline, commitment, and consistency. It's very, very important. So people get tired and they just drop along the way. Just a little recovery some people have. Maybe they're having this paresthesia under the feet and it just disappears. They just throw everything away and say they are not going back again. That's not how it's done. You must have to kill diabetes till it is, in fact, you can't detect it again. And that's one of the best ways to handle diabetes. It's like you can't live with diabetes and live comfortably. It's just like living with a snake in the same room. One day, it can strike. Then use of orthodox medication to get out of danger and use of natural pharmaceuticals for effective management and reversal of diabetes. So how does dieting help reverse type 2 diabetes? You can see this man down at the bottom right portion of our screen. The wife is encouraging him because my brother and sisters in the Lord, it is not easy. Just imagine this man here now. Look at what this man has to start eating. You can imagine this Odogu. You can imagine this boss that when he enters the club, the whole club will begin to shake. Carrots and two things, I don't even know what it is. And he has to be eating this for a long time. You can see the wife massaging his brain and trying to tell him that he should continue so that he can get better. That is how difficult it is to manage or handle type 2 diabetes. If you look closely here, you can see that we're asking, how does dieting help reverse type 2 diabetes? You can't escape it. Weight loss can help us with that. It can help to improve insulin sensitivity, reduce glucose intake, increase fiber intake, improve blood lipid profiles. Now we talked about how diabetes can lead to poor blood lipid profile or increased bad cholesterol, reduce inflammation, improve gut health, reduce blood pressure, and so on and so forth. Now, by making sustainable dietary changes, individuals can improve their overall metabolic health and manage type 2 diabetes effectively. In fact, you can manage it out of existence. Note that we don't use the word cure. We'll talk about certain kind of conditions. We don't use the word cure because we can use the word cure when you have a parasitic infection or a pathological infection, pathological disease that is like malaria, take anti-malaria, that one has gone, you're cured. Or one has one disease or the other that one takes the remedy and it's gone, the person is cured. But in lifestyle diseases, use the word manage, remission, and all that to be more difficult. So how does exercise help reverse type 2 diabetes? Every day, I keep putting one advice or the other because we have this group where there are thousands of patients that I talk to every day, patients and friends and exercise and health enthusiasts. And I keep saying that 15 to 30 minutes of exercise out of 1,440 minutes a day can save your life. A lot of people do not know that diabetes was actually on the way until they started doing exercise every morning. And I always encourage people, when you are done with exercise, you put an emoji on the group, a tiny emoji to encourage others to also do it. If I tell you how many patients have been giving me testimonies with regards to this exercise we're talking about, you will not believe it. Uncountable. There are so many. Some are even calling their friends to come and join because this is just the way to go. Now, it improves insulin sensitivity, increases glucose uptake, boosts insulin production, enhances mitochondria or powerhouse function, increases muscle mass, thereby allowing more cells to draw sugar out of the blood. Of course, improve cardiovascular health, supports weight management because it burns off fat, which is basically the major factor in measurement of obesity. Then, of course, reduce inflammation, improves mental health, and increases aerobic capacity because regular exercise improves the body's ability to transport oxygen and glucose to cells, enhancing overall metabolic health. Let us also note that it's essential to combine exercise with a balanced diet, natural pharmaceuticals, and other lifestyle changes to effectively manage diabetes or type 2 diabetes out of existence. Now, weight loss. This is where a lot of people, in fact, they run away from this section. But you can never run away from this because weight loss will help with insulin sensitivity, increase glucose uptake, improve pancreatic function, reduce inflammation, improve blood lipid profile, lower blood pressure, improve sleep. You know that a lot of people that have type 2 diabetes find it difficult to sleep at night. Any little thing they are woken up, they sleep like watchdog. Then increases mobility. Remember that when one reduces weight, then one can be able to exercise even better. That is why it's important you must lose weight. But be aware that obesity is the mother of lifestyle diseases. Of course, then this will help to reduce medication needs. You and I know that all these drugs are all poison. That's why you must have to stick to your prescription and try as much as possible not to enter problem, because taking these drugs and not taking them is like being in the between the devil and the deep blue sea. Just like you just have to make sure you don't get into that middle path. Now, a modest weight loss of about 5 to 10% of body weight can have significant benefit for type 2 diabetes reversal. Can you imagine that? Just if somebody is weighing 100 and you just reduce to 90, you may be shocked that your sugar level will just go back to normal if you are lucky. But I always advise patients target your normal BMI range, which is usually 18.5 to 24.9 kilograms per meter square. And that is why weight and height is important to calculate that. Once one can maintain this for a very long time, oftentimes this diabetes just disappears. Autophagy simply means giving your body enough time away from food so it can convert unwanted materials into wanted materials. That's what basically it is. Your body can consume unwanted materials, like those things that are blocking the blood vessels, like those fat cells that are producing adipokines and adipocytokines. Your body begins to consume them and convert them from food to food. And you can only achieve this when you undergo professional or intermittent fasting. Professional intermittent fasting, aka autophagy. That autophagy takes place when you have professional intermittent fasting, and we're looking at about 18 hours. So for those of us that say that my consultant told me that breakfast is the most important meal of the day, you that you are still growing, that you are in nursery school, right? Once you are 35 years to 40 years and above, and or you have a lifestyle disease like hypertension, type 2 diabetes, obesity, fatty liver disease, and so on and so forth, breakfast is a scam for you. Just know that it is not compulsory. It is not compulsory. If you don't eat it, nothing will happen to you. In fact, you'll be healthier when you don't eat it. You can ask people that undergo fasting to tell you the truth, how they feel after fasting. I believe that maybe 99.99% will tell you that they feel much better after fasting, because that has given the body the ability to consume unwanted materials. Let me give us an example. In the liver, where people have a lot of fat, when they're having fatty liver disease, the body begins to consume that fat, and liver becomes free enough to carry out its metabolic function, which includes controlling or regulating the amount of cholesterol in the blood, because the liver produces about 80% of cholesterol in the blood. Can you imagine? That's just one example. It can even help the liver consume scar tissue that has formed as a result of issues, and a whole lot of other issues, a lot of other things. It also consumes fat directly that leads to overweight, that causes spondylosis and also causes osteoarthritis of the knee. So you see that these are things that nobody will tell you, especially those that are selling drugs that are used to treat all these things, because nobody is going to make a campaign against his own business. For instance, the Lord, don't be offended, but it is just business. So when you hear things like this, just grab it and run away with it. Then we have professional fasting. Autophagy can help against type 2 diabetes in the following ways: lowers blood sugar level, promotes weight loss, improves insulin function, reduces waist circumference, talking about abdominal fat, reduce risk of complications like heart disease and nerve damage, can help manage diabetes without medication. Can you imagine? Reduce need for insulin, counter other associated lifestyle diseases. You know that type 2 diabetes comes with its own Ashebi lifestyle diseases, and of course, improves overall health and well-being. So let's just delve into chemical intervention. Please and please, I'm not saying you should disobey your health practitioner I'm not saying that you should not stick to your prescription or your drug regimen. But please, let us just know what these side effects are, just in case one is experiencing them. That's the reason why. Then just pick a few of them so that we just be aware or be vigilant. But for me, for instance, okay, let's start from their uses. Let's start from what they are used for, why we give them. We will not go deep into them. So now, chemical intervention, oral medication, for me, that's glucophage, PAM4 and all that, helps to decrease glucose production in the liver and increase insulin sensitivity. Then we have the glimepiride, we have the meglitinides, and so on and so forth. Then we have the linagliptin pharmacy, that is dipeptidyl peptidase 4 inhibitors or DPP4 inhibitors. Then we have all that. Then we also have the injectables. Ozempic, everybody is running to Ozempic for now because they don't know that when the pharmacy companies that have made them have enjoyed themselves and they're not satisfied, they start hearing stories maybe about their side effect and all that. Please be careful. Any little things, people are saying they want to just go and inject themselves with Ozempic, shortcut to getting slim. Bear in mind that Ozempic's shortcut to getting slim is a side effect. Have they told you the other side effects? Have they even told you that Ozempic can lead to death when one is hypoglycemic? These are questions that people should ask themselves. Then, of course, we have the insulins and all that. Oh, these are the side effects. Let's not even go too deep. I'm not saying that we should not stick to our prescriptions, but please look at this screen. Let's start with our popular metformin that people keep chewing like chin-chin because it's inevitable. It causes nausea, vomiting, and so on. Lactic acidosis. Remember that diabetes causes diabetic ketoacidosis. Now, the drug that they are giving to counter what can cause diabetic ketoacidosis now causes lactic acidosis. That shall never end. Which is rare but potentially life-threatening condition caused by build-up of lactic acid. That means even the drug that they are trying to use to prevent diabetes can even kill the person itself. Vitamin B12 deficiency can be provoked by even that metformin you're talking about. You know that B12 deficiency is what leads to that peppery sensation under the feet and all that we call paresthesia. So now you are taking a drug to help you counter paresthesia, but the drug itself is actually causing paresthesia. Then we have the sulfonylureas. This one causes hypoglycemia or low blood sugar, weight gain, allergic reactions, increase in risk of cardiovascular events. That's just trying to say stroke or heart attack. That's just a diplomatic way of saying it. Then we have let's look for some other one, the linagliptin family, upper respiratory tract infection, headache, muscle pain, increased risk of pancreatitis. Wonderful. I think we should just keep this part so we don't go too far. Ozempic, nausea and vomiting, diarrhea, abdominal pain, increased risk of pancreatitis. Wonderful. Increased risk of thyroid cancer. Okay, and so on and so forth. Let's just read this place. It's like a horror movie. Then, what are natural compounds in reversal of type 2 diabetes? Please, let's take note of this. This natural part is often the safest way to manage this disease condition because they don't have side effects. So, if you can find these compounds anywhere, enjoy yourself under the guidance of a trained health practitioner. Chromium picolinate improves insulin function, improves glycemic control, reduces glycosylated hemoglobin in red blood cells. Can you imagine? That HbA1c people measure when the C1 is above about 6 point something, that the person is having high risk or already having diabetes. Then we have vitamin D, lutein and zeaxanthin for the eyes, coenzyme Q10 against cardiovascular issues associated with type 2 diabetes like hypercholesterolemia, cobalamin, folate, and pyridoxine. We're talking about B12, B6, and B12, B9, and B6. That's their baptismal name. Then we have thermogenics, like you see, capsaicin is just another way of mentioning a compound inside pepper, like black pepper. Our mothers will do omugo and do pepper soup for the woman that just put to bed, and she'll be drinking it and saying that the hot pepper soup is melting her stomach. No, what is melting the stomach or making the stomach go down is the capsaicin and other thermogenic substances that our ancestors were giving to to their daughters after childbirth, you can see that there's wisdom in what they were doing, even though they did not know exactly what was possible. Of course, we have catechins and epicalocatechins. Hydroxycitric acid is not left out. That one prevents conversion of carbohydrates to fat via the mevalonate pathway. Scientists in the house about the mevalonate pathway, where we have where that is the point where drugs like your 3-hydroxy 3-methylglutaric coenzyme A reductase inhibitors or statins or so, like the atorvastatin, where they act on, you can see that you can use this to support 100% naturally. Then we have chlorogenic acid, the lecithin that improves insulin function, and all that is a drug called something called garlic thyme also that contains this lecithin amount. And I think cardio or something. Find out shortly. And these also help to hinder cardiovascular issues, support liver health, and improve glucose usage, and so on and so forth. So let's embrace this, but they don't have side effects. Yes, you can see the importance of natural pharmaceuticals in management of and or reversal of diabetes. And they help to reverse diabetes, especially pre-diabetes. They help to improve the secretion of insulin. They help prevent diabetes in susceptible situations. That's when someone is having genetic risk. They prevent genetic sentence. It's not genetic sentence as far as what I mentioned the last time is concerned. They help to attack free radicals that attack DNA and may lead to production of faulty insulin or faulty cell receptors that may not recognize insulin and cause or worsen diabetes issues in the brain. They reduce excess glucose in the blood, reverse and prevent damages caused by diabetes on the organs of the body. They help in management of cachexia, that is unexplained muscle loss or weight loss. You see that people that have diabetes, they usually start from being fat, then they get deflated and begin to emaciate. That is cachexia. That is, they are being dried up. Let's just say via osmosis, they are being dried up by the high blood sugar in their system. Weight management is not left out. Erectile dysfunction is not left out because they help to resolve erectile dysfunction caused by diabetes. They help to resolve infertility caused by diabetes. Be aware that the chances of having or getting pregnant in cases that patients have diabetes is usually much lower. They also help to resolve mood disorders associated with diabetes and amputation. Now we talked about depression and suicidal tendencies. So you can see that helps a lot. Now, I want to talk about some products here now. These products are what contain the active ingredients. I'm not saying that you must buy these products, but if you're my patient, this is what I will use for you. So let's focus on the active ingredients that are in the products. Anywhere you can find these active ingredients, please enjoy yourself. But if you're my patient, I'm going to give you these products because this is forever living product that have been here for about half a century and they do not compromise standard or quality. That is why I use their products. So let's focus on the active ingredients. And if you are my patient, just know that this is what I'm going to give to you. Because this is what I've been giving my other patient and it's working. So there's no need for me to change. We also have other companies that produce these things. But if you are lucky to fall into or lucky to have access to the ones that are original, because the problem now is fake. Now, Fields of Greens contains chromium picolinate. We know what that does. Super Greens also does that. That is Super Greens over there. Then we have aloe gel. Of course, you can see what it does. It's a powerful adaptogen that regenerates cells and prevents the damage of DNA. It's a very powerful adaptogen. That means it regenerates and rejuvenates cells and also directly reduces blood sugar. It also helps to make production of insulin and function of insulin optimal. You understand? And a lot of other things. I don't like talking about this product because it does too many things. It has been used for thousands of years. Even the Egyptians have been using it before Jesus Christ came. Then we have the Active Pro B because it contains good bacteria. Remember that there is a very strong link between our gut and lifestyle diseases, as well as our gut and immune system, and so on and so forth. So we're not going to talk too much about these things because of time. Don't forget that lack of vitamin D can lead to or predispose one to type 2 diabetes. That's dicalcium malate and 1,2,5 dihydrocholecalciferol there. Then we have nature mint that contains chromium, and so on. Then this immune blend boosts immunity, which helps to prevent infections that can lead to diabetic foot. Then we have the Plus that contains L-arginine that will help to widen the blood vessels, that helps to also counter the shortage of blood flow to organs in the body as a result of deposition of bad cholesterol in the blood vessels as a result of what? Type 2 diabetes. That means it can also help to improve blood flow to the erectile, that means it can improve blood flow to the penile shaft and help to counter erectile dysfunction. Then we have eye vision. We're talking about the diabetes affecting vision as a result of damage to the retina or the macula, and can also lead to age-related macular degeneration, glaucoma, cataract, and all that. But this natural pharmaceutical contains lutein and zeaxanthin and some other powerful antioxidants and a lot of other things that can help with the eyes. This is actually being prescribed in many hospitals all over the world. And prescribe this a lot. Then we have B12 plus. This contains B12, B9, and all that, which helps to maintain and protect the nerves, help to regenerate and rejuvenate the nerves, and help to improve nerve functionality. Remember the link between diabetes and those peppery sensation under the feet and all that. They should take care of that. And also support eyesight, because the optic nerve is also a nerve. Support brain, because the brain is just full of nerves, just like a ball of nerves floating in fat. And you can see that that will help. Then we have cardio health, which contains coenzyme Q10. We talked about its ability to reduce cholesterol, and also it regenerates and rejuvenates the heart, the lungs, the liver, the kidneys, which are points of attack in diabetes oftentimes. We talked about lecithin, and garlic thyme has lecithin. We talked about how it helps to do a lot, and of course, reduce peripheral resistance via cleaning of the blood vessels and all that. Then we also talked about infection that can lead to diabetic foot because of the high concentration of sugar in the blood, and bacteria loves sugar. So you can see that's also very important to note. This propolis is a beehive product that has very powerful antimicrobial activity, antiviral, antifungal, and antibacterial activity. That is why it's a very potent agent against diabetic foot. This aloe blossom tea basically contains chamomile and other things that helps to reduce anxiety that are having, or that is often associated with people that have diabetes. Reagent is a fountain of youth, meaning that it helps to repair everything repairable, especially in the brain, because it contains choline, which we know is a precursor of acetylcholine, which is a very powerful neurotransmitter in the brain. We have multi-marker, which directly resolves erectile dysfunction. Then we have vitalized men and women, which actually helps to vitalize male and female sexual function, and also helps to counter libido in association with multi-marker, as well as to improve hormonal balance and all that. So these are just a few of the things. We talked about weight management. Then this is a Clean 9 program that is a holistic approach, holistic professional approach to weight management. It's a 9 days detoxification and weight management program designed to reduce caloric intake and increase caloric expenditure systematically via use of low caloric diet plan, exercise, autophagy. We talked about that earlier, therapeutic fasting, and natural pharmaceuticals, while ensuring nourishment that doesn't lead to malnourishment. A lot of people undergo malnourishment and say that they are losing weight, and then they come and say they're having disc desiccation, or they're having one problem or the other. These are the things that we need to know about. Of course, this is how it goes about this. It generally helps against other lifestyle diseases that promote diabetes, ensures weight loss without damage to cells and tissue of the body, removes fats, and tackles free radicals, and so on and so forth. So this is what it contains. We're already familiar with this. This indeed has functions that are numerous. This helps to ensure that there's nourishment going into the system. This helps to ensure that bacterial growth in the gut is maintained and is optimal. And of course, we know that good bacteria in the gut leads to better immunity, because there's a strong link between gut health and immunity. Of course, let's not even forget the fact that it helps to cleanse the gut of all forms of debris and all. This is the thermogenic substance we talked about. helps to, burn fat and produce energy. That's the hydroxycitric acid we said that prevents conversion of carbohydrate to fat. This contains chromium trichloride. I usually give it to patients that I'm trying to wean off overeating, especially after they've undergone the C9 program. Usually tape is there, it's a good guide. And I'm going to leave us with this. You are what you consume. And there is a constant battle between factors that repair and protect our bodies and those that break it down. We simply have to be on the side. Your food may be killing you, like this executive banker that has eaten and has been sleeping at McDonald's until he's now being eaten by a product of McDonald's. So we just have to be careful. And let's not forget that this man is not joking. He says, do not adjust medication and dosage without the guidance of a trained health practitioner. Very, 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 very. Yeah. Prevention is better than early detection. So people say something must kill a man. Please let me eat today. Who knows tomorrow? Be careful, because what you do today can lead to what? A problem tomorrow. So prevention is better than what? Early detection. Begin now. I wish I knew the things I knew today when I was in my primary school. I would have lived a better life than I did, honestly. The choices you make today, or the choices we make today, determine how healthy we'll be tomorrow. This first door is telling you, please, just let's go to McDonald's and just move in and live there. This one says, do not exercise and play video games all day. This one says, live healthy and avoid alcoholism, smoking and all that, weight management and all. Any of these doors this person goes into will determine how you'll be today. Of course, if you go through this last door here, it's going to have a long life. Or longer life. Let's not forget that aging is not a disease and only needs maintenance. And on this note, I will say thank you for coming and remain blessed. Bye.